Hey guys, it's your girl Frankie here, and today we're going to talk about tips you need in order to succeed in nursing school. Okay, I am no stranger to nursing school. If you guys have been following my journey, I have transitioned from LPN to RN, so I feel like I'm a pretty good resource to talk about how to succeed in nursing school. So we're going to jump in strong and get started. All right, guys, so tip number one is NCLEX style questions. I've said this a million times, if not more, in so many videos. You want to definitely get on the NCLEX style questions, okay? You want to be doing those questions daily. I don't care if it's 10 a day. Like, you want to be doing NCLEX style questions on the subject that you're working on at that time. If we are talking about the fundamentals of nursing, then you want to do NCLEX style questions based off fundamentals of nursing, right? If you are doing med-surg, then you want to do med-surg style questions. If you're doing OB or pediatrics, then you want to focus on that for that particular point in class of what you're talking about, because that is how you start to figure things out, right? At the end of the semester, all the stuff that you have discussed for that whole semester, then that's when you will take those subjects of what you discussed, and then you will randomize questions based off of all of that to kind of summarize your semester with NCLEX style questions, right? And when you get towards the end of nursing school, then you want to combine, like, just do random of all the subjects, because by then you done all of that, med-surg, pediatrics, all that stuff. You want to just randomize stuff, and you go sit down for the NCLEX. You don't know how many questions you're going to get, but you do know the cap is 275 or whatever questions that you could possibly get. So you want to train yourself to be able to sit there and actually get through that many questions in case you get that many questions, right? So tip number two is your nursing books. You guys know them nursing books. One, most of the time are thick. Two, they give you multiple chapters to read in a week, and it's overwhelming. I'm telling you right now, see how thick this book is? I'm telling you right now, use this as a resource. Do not use this to read every word. Do not read every chapter. We ain't doing it. Don't waste your time. That is not going to help you retain any information by reading these long chapters. And no, we're not doing it. Use it as like a dictionary. You know, when you go to look up something, we're using it like that. Use it in that form and fashion. So if you guys are talking about diabetes, type 1 or type 2 does not matter. That's when you go to your book and you say, okay, where's the chapter over diabetes? Boom. I'm going to flip to diabetes. And now I'm just going to get the key points out of there. What is diabetes? What causes diabetes? What's the signs and symptoms in case I get a patient that comes to me? How can I identify they may have diabetes? And then what test or lab work are we going to do in order to confirm if they have that disease? And then once we do confirm that, okay, well, what are their interventions? What are the treatment plans? What are treatment options that we can offer for these patients, medications? And then also you want to look at patient education. What am I going to teach my patient about this disease, about their treatment, about how to take care of their bodies, all of that stuff. So you want to break it down in categories in your brain, okay? Because if you're just reading it and it's all jumbled, no, you want to get a clear understanding of what this particular disease is. So tip number three is finding out your learning style. I feel like a lot of us as humans do not know how, or as students, do not know our learning style. So definitely, it's plenty of free tests you can take online to figure out your learning style. Are you auditory? Are you visual? Are you hands-on? Things like that. Figure out what your learning style is, and then I want you to incorporate that in your studying, because it makes a big difference. Because if I'm not a auditory learner and I'm more of a hands-on learner, then me listening to lecture is not really going to help me. That makes sense? So you can listen to your lectures, all that stuff, but if you're hands-on, you want to cater activities or if you visual, you want to cater activities and things like that that fits your learning style for you to learn. So if I am visual, then I want to see the diagram. I want to see the charts. I want to see this, you know what I'm saying? Hands on. I'm going to be the one that's building models, or the one that's writing stuff, or, you know what I'm saying? Basically creating things that's going to help me to do that. You know, I'm hands on. Okay, well, I'm going to do assessment on my kid. I'm going to do assessment on my significant other, or my sister, my brother. Like, I'm finna practice to make sure that I understand. You know what I'm saying? So find out your learning style. That will help you tremendously at the beginning. Learn it at the beginning. Okay. If you already in your third semester or second semester, hopefully you have kind of figured out your learning style, and just do the test to know for sure. But if you are struggling, there's probably a reason why you're struggling. It's not because you're stupid. Okay. It's because you have not figured out your learning style. Tip number 4 is finding out if you are a group, like, you know how they do study groups. Are you a study group type person, or are you an independent type of person? Me in nursing school, I'm independent. I like to study on my own, to come to my own understanding. When I'm dealing with group studies and all these different reasons of why and their own things of, oh, I think it's this way because this is it confuses me, and I don't like it. So I like to have my own clear mind of how I think without the interference of a group type of thing. So you have to decide if you are, do you do good in study groups, or if you are better off studying alone. Now, tip number 5, you want to use your teachers to your advantage, right? You want to use your teachers as a resource. I know you want to be independent. I know you don't want to really ask for help. You want to just figure it out. But if you don't know something, that is what they get paid for, okay? If you are confused about something, then you need to talk to your teacher to see if you can get a better understanding of what it is that you're confused about, okay? When it comes to asking questions, when they're going over lectures, stay engaged, ask questions. If it's something you're not quite sure about, ask questions. If you wait after the lecture, you say, you know what, I went home, I studied, and I see that I'm not getting this, don't hesitate to email your teacher or wait till next class and talk to your teacher about something, okay? Tip number 6 is to study or recap what you have learned that day in lecture right after class. I know it's overkill. I know you're like, I don't have time for that. But I'm telling you, retain more information if once you sit through class and listen to lecture, and once you make it home, look through your notes again. Just read your notes again. Look over your stuff again. And I feel like that's the best time to kind of study. Yes, you are probably tired and you don't want to, but you will retain so much more information that way. If you look over your notes right after, you know what I'm saying, you make it home from lecture, or if you're virtual, go through your class, and then I want you to sit there just for a couple minutes or so, 10 minutes, 20 minutes, and look through your notes. Just read through your notes, read what you have learned, recap in your mind what you have learned, however it is to go over what you have learned from that lecture or that class, do it. Okay, and for tip number 7, I think I'm on tip number 7. Yes, tip number 7, you want to study without your books or your notes. And I know you're like, girl, pause, what is you talking about? Yes, study without your books or your notes. Whether that be using a whiteboard, note cards to write on, or just in your, I like to do it here. I like to do it here because I feel like I retain so much more when I just do it up here. And what I mean by that is that I will sit there and I know I would be thinking, okay, we went over hypertension. And then I would ask myself, what is hypertension? Boom, I'm answering myself, right? And I'm just sitting here, or you can record yourself on your phone with the voice recorder and say, what is hypertension? Boom, give your answer. Hypertension is blah, 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 blah. Okay. What are some signs and symptoms of hypertension? Boom, answer yourself. I'm telling you, because when you start going through the different things of a disease process and treatment options and medications you would give and stuff like that, you will realize like, oh man, I really don't know that. Yeah, you know it if you're looking at your notes because you're reading it. But when you start doing it without looking at your note in your books, and you're like, okay, what medication would I give for hypertension? And you are really like, you really don't know. You're like, man, I really cannot think of this. Then that's when you're going to take your pencil and write on a note card, write on a whiteboard, and you will write out like, okay, study medications for hypertension. Because it's kind of like a quick note to yourself, like, okay, I need to go through that. Because when you actually go through it, you'll realize like, oh man, I really do know this disease. But because of so much information, you get so confused, it kind of jumbles up your brain. But just focus on one thing at a time, okay? That's going to lead to tip number 8, and that is creating a template for yourself. That will help you to keep your thought process in line. I feel like sometimes, like I said, it's too much information at one time in nursing school, and it can be very overwhelming. You can get things mixed up. A lot of these diseases are similar or have like, they're like identical to each other, but they're different things. It may be one thing that may be different. Like, it can be just so freaking confusing. You want to focus on stuff that you do not know. And in order to find out what you do not know, you have to stimulate your brain and actually ask yourself questions, answer yourself, see what it is that you know off the top of your head and what it is that you struggle to figure out. Then you want to focus on that area of that particular disease process. With tip number 9, you want to have a social life. I know it sounds crazy and difficult to do because everybody tell you. I've known nurses that literally worked full-time jobs, had whole families, still was in nursing school full-time. Like, if they can do it, trust me, you can go out with your friends one day out the week. Okay, you're not gonna die. It's okay. And tip number 10, y'all, we have made it to the end. Okay, tip number 10, which I say for last because it's one of the best. YouTube is going to be your best friend. Okay, YouTube, and you got to find replicable YouTube channels to watch. And if y'all don't know, y'all about to find out. Another person is Mark Klimick. I want to say I said that right. Him. I talk about all this of how I study for NCLEX, all this stuff, and I will put a video up here of my favorite YouTube channels that I like to use for learning nursing stuff. But I'm telling you, YouTube got me through it. Okay, and once again, I'm a visual learner. And also, like, the lecture the teacher give you is not going to be the same as these YouTubers. And there's only a couple of them that I feel like are replicable and actually give accurate information. And I've took that information, I've studied from it, and I've like, killing the game. Okay, but Mark Klimick, people were sleeping on him. I'm telling you, he is my number one source for the basics. When I say I listened to his lecture and did his little note thing, and I think I have it on one of my videos. If YouTube have not took it down, like, I'm telling you, they be hating on us nurses. He is one of the best in the game. And when I say, when I went into to sit for my NCLEX, I say it was easy. Mark Klimick, he got me right. And when I say my NCLEX test was basically what he said it was going to be, it was. It's crazy. If you have any questions for me, definitely comment them down below. If you want another video on in-depth discussions on some of this stuff that I talked about, comment that down below. I would get that out for you guys because I absolutely love talking about nursing students and tips on how to study and pass, because nursing school is already hard as it is. But we're here to make it easy. Okay, we're gonna make it an easy transition for you, an easy school year for you, because we can make this way easier. Okay, as always, I will see you guys in the next video.